My granny's truck had a gear named after her. It's the Medicare for the Lazy Man podcast. The Housebroken Medicare podcast. Preaching to the choir, it's Medicare expert Doug Jones.
Well, hey there, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is Doug Jones, your Medicare expert, and I plan to be here all morning for your edification, your Medicare knowledge acquisition. I like to help people acquire Medicare knowledge, and one of the ways I do that is to encourage them to consider purchasing my book, Medicare for the Lazy Man 2025. It's waiting for you at barnesandnoble.com or at amazon.com, and it's waiting for you in several formulations. It could be the ever-popular paperback, which is the way most people acquire Medicare for the Lazy Man 2025, or you might want to have the Kindle version downloaded to your reader. If you're an Amazon customer, you might have a Kindle reader. That's like instant gratification, and it's so reasonably priced at $4.50. You can't go wrong with that. The other options are you can listen to the book being read to you by a velvet-voiced, experienced book reader. And I don't know what that costs. That's every time I look to see what it's going to cost somebody to purchase the Audible version of Medicare for the Lazy Man 2025, it says it's going to cost them nothing. But that's if you join their Audible club, and you have to listen to a lot of books, I guess, if you're a member of that club. And of course, I always want people to know that there is a fourth alternative available. That is the hardcover version of Medicare for the Lazy Man 2025. It is a magnificent creation. It is durable. It is beautiful, and it's useful. I've suggested uses that people can put this addition to. Most importantly, I want people to know that I promote that as an alternative because it is a substantial creation, and it's excellent and very impressive for gift giving and so forth. But the profit that I make on that book, in spite of its very high price, is minuscule. In fact, it's the same as I make on the Audible book. It's the same that I make on the paperback book, and it's the same amount I make on the Kindle version, and all of that money goes right back out the door to promotion. So I don't make much on the book at all. If anything, what I do is I help people cross over into Medicare. They need a Medicare supplement in order to have the best coverage available, and that's what I do. I'm an insurance agent, and I sell people Medicare health insurance coverage to make their encounter with Medicare a rewarding one, a very happy one, one that is going to prepare them for the worst eventualities, even though we always hope that those eventualities never occur. So that's my task in life and my goal. And I'm sure there are other people connected with this podcast that have their own goals in mind. They're here for their own purposes, and I'd like to hear from staff member. Yeah, hey, you, sir, could you let me know what it is about being a part of the Medicare for the Lazy Man podcast monolith that you find rewarding?
Yes, I will.
Please do.
My goal in life is to eliminate the term silver sneakers.
Okay, well, how's that going for you?
It's not working all that well yet.
Oh, boy. Well, I'm sorry to hear that. You might have recognized this voice. We were play acting, but that is Randy Carson, the producer of this edifice, and I am always happy to have him joining me because when things go wrong, he has to jump in and fix them. So thanks for your contribution, Randy. I appreciate it.
Well, you're absolutely welcome. I just wanted to point out that the temperature is now 86 degrees.
Wow, went up 3 degrees since the last time you
Yes.
read that. That's
Yeah.
fantastic. This is Arizona. This is what we pay for. This is what we always look for. And when my friends in Illinois call me and laugh at me because it's warmer in Illinois than Arizona, that happens like once a year.
Right.
Always, it's more pleasant here than in the Midwest, the upper Midwest. So I'm always grateful to be in beautiful Arizona. Now, we have a job to do, and that is to help people understand the pitfalls, the potential pitfalls of Medicare Advantage plans. Sure, they're cheap, but you give up a lot of freedom. And once you involve yourself in a Medicare Advantage plan for a certain period of time, you can't go back in most states. So you're really going to be finding yourself, if something bad happens to you medically, you're going to find yourself in a poor position, and you're going to be at the mercy of a bunch of accountants. They're not doctors that manage your managed care. They're accountants. And so we have a stack of articles in which we explain and warn people. And Randy picks out a different article from that stack in each of our podcast episodes. Now, we got a kind of a strange situation today. I got a phone call from Elon Musk, and we have been doged. So we
Yes.
we are not able to present the article that I had hoped we were going to be able to present, and it's going to be, unfortunately, an article-free episode today. I hope the audience isn't too crushed and disappointed by that.
Darn it.
Well,
Everybody looks forward to that. I know.
I always look forward to your description of the angst that you go through just picking out the letter that we're going to.
I know. It's terrible. I struggle, and I look at it and I read it and I study and I research, and finally I have to come up with a letter. And then on top of that, I have to translate it
Yeah, yeah,
into the NATO phonetic alphabet.
right. Which you must have taped to your wall, I'm guessing. But in
I
any
do,
event,
I have it taped. You're right. I have it taped to my overhead on in my desk, or
the reason
the overhead shelf.
the reason I knew that was that every time you use an acronym from the NATO list of phonetic letter pronunciations, you look at the same place in the
No,
sky. And I know
yeah.
it's either Jesus up there holding that list for you.
I'm s- what 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 is that letter that I'm looking for?
It's like a stage show, like a hypnotist looking,
Yeah,
for the secret sign from one of his
it's like
victims.
on this was kept on the porch of Funkin' Wagnalls in a mayonnaise jar since 9 this morning. Who
Well,
did
I'm
that?
I'm pretty sure that would be Johnny Carson.
You got it.
And if there's anybody around here that knows more about Johnny Carson, it's certainly you, Randy Carson. Any relation
Yeah.
there? Yeah, who knows? Well, here's
Yeah, there actually is.
right, and he was the only relative I know of yours that did not become a dentist.
He was the only male in our family, other than myself, that was not a dentist. Johnny went into, show business and made millions of dollars, and the rest of
Yep.
my uncles went into dentistry and made twice or three times that.
Yeah, because they saved a lot of money on Novocaine.
Yes, they did. We're just about done. Oh,
Yeah, stop screaming. Stop screaming. Okay, so next item of business would be a segment from our big book, our big giant government manual of your Medicare Benefits 2024. I don't know if they're going to do a 2025 edition. I can't believe that there are new Medicare benefits to be had. But today we're going to discuss gym memberships, and we're not going to use that terminology that Randy hates so much. We're going to avoid
silver
that.
sneakers.
Stop. Don't say that.
I don't want to hear that. No.
You won't hear it. You won't hear it. Gym memberships and fitness programs. How will Medicare treat that? Well, here's the bottom line. Medicare does not cover gym memberships or fitness programs. So you're going to pay. Here's a section about costs. What are the costs involved with Medicare and gym memberships? You pay 100% for gym memberships and fitness programs. Now, if you want more information, if that's too difficult for you to understand and you need an explanation that's even more detailed, go to this website, medicare.gov/coverage/gym, GYM, dash membership dash fitness dash programs. And you're probably, when you get there, you're probably going to be told, hey, dopey, we told you that we're not going to pay anything for it. So that's what you're going to see if you go to check that out.
No, you know what you're going to see there?
I don't really know what
A
they're.
great big goose egg. That's what
Yeah,
you're going to see there.
yeah.
How
And
much do you
frankly,
pay? Zero.
and
Absolutely nothing. De nada.
and that's going to irritate a lot of people. How come they won't pay? It's always better to be healthy and, go to the gym and all that stuff. Well, I'll tell you right now, I do not want my government to be giving away gym memberships. When they extract tax money from me, I expect it to go to something useful and something. If they're going to give it to other people, I expect those people to be in dire straits. I don't want to hear any stupid gym memberships or what are some of the other things that people ask? Oh, dental and vision coverage. Pay for it yourself.
I help eyeglasses, gym
Yeah,
memberships, dentistry, uh,
cosmetic surgery.
cosmetic surgery, dancing lessons. I mean, it's all that.
There's a lot of stuff that Medicare doesn't cover, but most of it is stuff that you can either choose to do or not do. And frankly, I want to see Medicare save people's lives and fix, serious medical problems, but not be spent frivolously. You want to go hang around the gym? I say pay for it yourself. I've got an article here about somebody who had a tragic end. This is a person who, the headline here is Iowa nurse has been sentenced to prison after patient death. And I'm not going to read the whole article, but basically a 70-year-old nurse was on the overnight shift at a nursing home or a nursing facility, rehab and nursing facility in West Des Moines, Iowa, back in February of 2023. An 87-year-old patient indicated that his tracheostomy tube in his neck, I thought it would be tracheotomy, but that's not what they have here, tracheostomy. His tube in his neck needed to have fluids suctioned out. The woman was the sole nurse on duty, and she refused to do it after repeated requests, and eventually the patient died. Earlier that night, she reportedly told the director of nursing at that facility that she was unwilling or unable to suction the tracheostomy tube, and the nursing director told her to watch a video and figure it out. So I'm guessing what she was saying was that she didn't know how to do it, and the supervisor did not help her in any meaningful way figure out how to do it. So I wanted to know what this had to do with Medicare, and I know exactly what it is because these people, this guy was an 87-year-old. He was in probably a facility that he would not have chosen had he had the freedom of choice. And when you have a Medicare Advantage plan, you are told where to go. And in my experience, the people that I've helped escape from Medicare Advantage plans are told after surgery to go to rehabilitation clinics or recovery facilities that are inferior and that are frightening in some cases. And that's probably what happened to this guy. He had a Medicare Advantage plan that stuck him in a rat's nest of inferior patient rehabilitation and post-surgery treatment. And I'm guessing that that's why he's dead now, because he did not have the freedom of choice that he would have had under a Medicare supplement plan to go to a high-quality nursing home. And I know Iowa, especially the Des Moines area, is chock full of high-quality medical facilities. And either this guy did not have the freedom of choice, or he was misinformed as to the quality of the treatment that he would get. 7 Medicare changes for 2025 that you should know about. I like lists because lists allow me to basically not pontificate too much because there's so many items. I don't want to spend a lot of time on any one item. Let's see how this list goes. Premiums and deductibles have risen. Premiums tend to increase regularly, and 2025 is no exception. The annual deductible for Part A hospital stays went up from $1,632 to $1,676. The Part B annual deductible for medical insurance went up from $240 to $257. And then, let's see, fortunately, most retirees don't pay for Part A. It's free of charge for everybody that's got 10 years of taxable work history in the United States. But they do pay Part B premiums, and that went up from 174.70 to 185. But we knew all this. This is not anything new to us. Prescription drug costs have been lowered. The Inflation Reduction Act, I call it the Inflation Production Act, has lowered the prices for dozens of drugs and capped the out-of-pocket expenses for those on Part D, as in dog, drug plans at $2,000 for covered drugs. Say goodbye to the donut hole gap. That's number 3. The donut hole gap in coverage. The Medicare drug deductible of $590 for this year. If you max that out, you'll likely pay just 25% of the cost of your drugs until you hit that $2,000 cap that I mentioned. After that, Medicare pays for everything for the drugs that are covered under your plan. Number 4, mental health coverage has expanded. Starting this year, more mental health providers will be permitted to serve Medicare enrollees. These include addiction counselors, licensed mental health counselors, and marriage and family therapists. Number 5, telehealth services have been restricted. I think this is probably a mistake to not support telehealth services. Let's see, telehealth services, such as when your visit with a healthcare provider is conducted electronically, perhaps via your iPad or your computer, will be less available this year. The new rule is that you must be in a rural medical facility or office to qualify for most telehealth services, with a few exceptions. These are the exceptions: monthly end-stage renal disease visits for home dialysis, services for diagnosis, evaluation, or treatment of symptoms of an acute stroke, services to treat a substance abuse disorder or a co-occurring mental health disorder, behavioral health services, diabetes self-management training, and medical nutrition therapy. Number 6, caregivers get more help. In Medicare's own words, Medicare covers additional caregiver support like training that helps your caregiver better care for you. I need a caregiver. And relief when they're caring for family members in hospice care. Also, some people living with dementia and their caregivers may be able to get more support through a new pilot program. And that's all they say about that. Number 7, coverage changes for postal workers. Okay, I don't think we have many postal workers in the audience, so I'm going to go to heads up, all of the above might change further. These are some of the main changes to know about for Medicare for 2025, but you should also know that some big changes might be coming soon, as the new administration in Washington seems keen to make them. Well, I'm anxious to see what they might be. Oh boy, I've got a lot of other lists here, but we might want to take a little break and ask Randy a question. Randy, if I were to ask you what the most dangerous state in America is, what would you answer? The most dangerous state. And I'll tell you what the criteria is. This is from our friends at Wallet Hub, so that should tell you what their slant is going to be.
All right.
They compared all 50 states across 5 key factors: personal and residential safety, financial safety, road safety, workplace safety, and emergency preparedness. The team of apparently they have a whole team of experts working on this, and they divided the data into 52 more detailed metrics to create a 100-point scale. They must have kept one of those giant ENIAC machines going day and night for a couple of years. Some of the metrics were weighed more than others. Take, for instance, the category of personal and residential safety, which includes things like theft, assault, hate crimes. Oh, that's somebody saying something that makes me unhappy, right?
Yes.
Mass shootings and murder. That would make me pretty unhappy. Well, they have God, they have made this so complicated, but yet they seem to boil it down pretty close to the same way that they have for all the other contests that we've had. This used to involve Medicare more directly, and now what it does is it is just political. And so I enjoy going through this with Randy. Randy, what is the most dangerous state in America?
Well, based on our other findings and the similarities and the correlations, I'm going to go with Georgia.
You're not that far off, and you're in the right political realm. It is, according to these knuckleheads, Louisiana.
Well, that's close.
Yes. Now, of course, are the dangerous states widely spread out around the country? No, they're not. They all seem to have something in common. Let's go with the rest of the list of the five most dangerous states. That would be Mississippi, Texas, Arkansas, and Florida. With Louisiana, those are the five most dangerous, heinous places to live, where you're probably going to have all your stuff stolen and possibly your life will be in jeopardy too. They all have something in common, don't they, Randy?
I know they do. What is that? Are you
Well,
identifying some similarity between those?
I think I perceive a pattern here that Wallet Hub has been foisting on us ever since they started doing all these reviews of, and rankings of states. But, let's be forgiving. Let's be Christian about it. Let's look at their list of the most magnificently wonderful and safe places to live, shall we?
Sure, let's do that.
All right, I'm going to list those five places in reverse order. I'm going to say the first one is Utah. That is number 5 on the list of the safest, most magnificent places to live. And there are a lot of great people in Utah, so I don't have an axe to grind there. Number 4, Massachusetts. Sanctuary state, as I recall, probably teeming
Yeah,
with illegal
yeah,
aliens.
yeah.
Maine is pretty
Yeah,
darn
well,
blue.
yeah, Maine's kind of an odd pick for nothing to do with being the safest state, but there's
Right.
other things Maine's struggling with right now.
Number 2 on the list, New Hampshire. Isn't Bernie one of the senators
Yeah,
from New Hampshire? Yeah.
yeah, I think so.
And the number 1 safest, most magnificently heavenly place to be safe in the United States is Vermont. So
Yeah, once again, they're all in the east northeast. What is so good about the northeast, huh,
it's
Doug?
something about their voting patterns. I'm guessing that
I'm pretty sure that's true. Yeah,
they got the whitewash, the Tom Sawyer bucket of whitewash out with a
they
big brush.
did. They did. Yes, they did. Except for I think it might have been blue paint.
Mm, you're exactly right about that. So what else do we have here in this? I've got a big giant stack, and I'm thinking to myself, how can I keep this interesting for the audience? Um, there is another list of Medicare myths. Let's talk about the Medicare myths that you should know about. Misleading things that people believe about Medicare that are inaccurate, incorrect. Number 1, the government will automatically enroll you in Medicare. Well, that's not exactly true. They'll do that for you if you're already accepting Social Security payments and you turn 65. So you can start Social Security payments at age 62 if you want. And then when your 65th birthday comes around, you'll find that you have been enrolled in Medicare by the Social Security Administration. Myth number 2, you can sign up for Medicare anytime after you turn 65. That's not true because, as I read in this explanatory blurb, your initial enrollment period for Medicare begins 3 months before you turn 65 and ends 3 months after the month in which you turn 65. That's a 7-month window of opportunity. Most people sign up for Medicare in this window. I disagree with that. I think working people are more prone to sign up for Medicare when they end their working lives and they're walking away from their group insurance plan that the employer has provided for them. That's when many, many, many people sign up for Medicare, and they can be any age for that, 68, 70, 100. So failing to sign up during the appropriate time can result in gaps in coverage and late enrollment penalties, which often leads to a lifetime premium increase. However, you can avoid penalties if you have insurance through your employer at age 65 and enroll in Medicare as soon as you lose that coverage. Number 3, Medicare is free for everyone. Well, that's not true. Part A, as we discussed, is free of charge if you have 10 years or more of taxable earnings in the United States. But Part B always has a monthly premium This year it's $185. And then if you have success earning, you have higher than average earnings 2 years or more prior, then you're likely to get hit with IRMA, the success penalty, and that's a whole nother can of worms. Medicare is all you need in retirement. That's number 4. Original Medicare, and this is why it's false. Original Medicare consists of Part A and Part B, but that leaves a big open gap that you would have to pay without an upper limit. And so you need a Medicare supplement plan and a drug plan if you ever want to have your prescription drugs covered by Medicare. And there are really inexpensive drug plans, at least this year. So even if you take no prescription medications, get that prescription drug plan. Otherwise, if you put it off, they're going to penalize you for the rest of your life at the point in the future where you decide you need a drug plan. If your doctor tells you, okay, start taking this drug, and you say, well, I better sign up for a Part D prescription drug plan, after several years of not being on one, then the IRS is going to come after you, and they're going to squeeze you for money that they think you should be penalized because you didn't sign up when you were first eligible. Medicare Supplement is the same as Medicare Advantage, and that's not true. Medicare Supplement is good. Medicare Advantage is evil. And so I'm not going to go through their politically correct explanations here. I will tell you right now that Medicare Supplement is the only way that I advise Medicare participants to go. Medicare Advantage, I advise everyone to stay away from. Number 6, you don't need Part D if you don't take any medications. Well, I addressed that just a couple of minutes ago. Number 7, once you sign up for Medicare, you're locked into a plan forever. That is not true. You can change Medicare supplements in all cases if you can show evidence of good health, or in many states if you can't. They have quirks in the law, which are increasing in number, that allow you to make a change in your Medicare supplement plan in many states. And if you have a Medicare Advantage plan, you are able to change that Medicare Advantage plan for a different Medicare Advantage plan, hopefully a better one, in the end of the year open enrollment period, or one time only the first 3 months of the following year. So those are Medicare myths from the Motley Fool. Medicare myths that you should know about. And the correspondence from clients is a popular item that we handle here on the Medicare for the Lazy Man podcast. And I've got a couple of things that are really, really old. One is from Carolyn, and she said, we are about 18 months, we meaning she and Mr. Carolyn, we are about 18 months into high deductible Plan G. That's the plan I recommend. And the monthly savings has allowed us to pay out of pocket for our chiropractic care and a direct patient care physician membership. Getting as much control over your health care is where it's at. Thank you for your advice. And I want to say, Carolyn, that is so nice to hear. Thank you very much for checking in today. She has brought a ray of sunshine to the people that listen to my advice. And here is some information from Bill. Let me see if I can recall what this is all about. He says, hey, Doug, so you found a Plan G for me that includes Ozempic. Sounds great. Unexpected. Then last week, a pharmacist told me the manufacturer coupons don't apply with Medicare. Yikes. That said, any idea what the cost would be? The pharmacist said they do offer their own version now at $299, so that may be the route to go. And this then may not be the best plan now. Was looking to switch to Wegovy, so the same question applies. And I priced out Ozempic and Wegovy for Bill. And I got to tell you, Ozempic with the cheapest plan that covers Ozempic, and if he buys, let's just take a random pharmacy. Let's say that he purchases all of his Ozempic from CVS in his neighborhood. His balance, his out-of-pocket cost for the rest of the year would be about $1,000. This is in Texas. So $995.60 would be his out-of-pocket cost, his copays for Ozempic if he goes to CVS and has all his Ozempic prescriptions filled there. If he switches to Wegovy, His out-of-pocket costs, same drugstore, same plan, same drug plan. Actually, I found a cheaper plan. Of all the ones that cover Wegovy, this is the cheapest one for Wegovy. His out-of-pocket cost at CVS Pharmacy in the same town in Texas would be $13,113 for Wegovy. So he's going to be a lot better off with Ozempic. And so I said, actually, Plan G is a Medicare supplement. What we're talking about, okay, he used some incorrect terminology. And I was telling him about my discoveries about the difference in cost. And he said, I should have known that, being immersed in other retirement choices and not paying attention as I should have been dealing with the evil IRS the last 2 weeks. So I got a little mixed up. So Wegovy is basically a no-govy based on the attachment you sent. Yikes. Ozempic at $995 for 8 months equals $124 a month, correct? If so, surprisingly not bad. I'm amazed you even discovered that. Great stuff here, and I'll be in touch. This really helps clear the smoke, as the wife's drug plan does not cover either of those two drugs. And then I said, your math is accurate. There has been a lot of turmoil in the drug plan market over the last couple of years, so be careful to recheck whatever plan you select. It must be double-checked in October and November to make sure it's going to be appropriate for you in 2026. So that is my advice to all people that have a Medicare prescription drug plan, because big changes are afoot. I don't know what's going to happen. Nobody does right now, but rechecking in the fall is going to be imperative. Randy, could you tap dance us on out of here?
Well, I haven't had any dancing lessons, so
that's right.
I don't know if we could do that, but I'll try.
We'll keep searching to see if Medicare is going to cover those dancing lessons.
Okay, well, I'm going to try. I know I saw it someplace. I don't know just exactly where it was, but it was called the Fred Astaire plan. I don't know
Oh,
just exactly where I saw it, but I'm going to keep looking.
all right. Let me know what you find out.
Okay, so here we go. Hang on to your hat, folks. We're going to bring this plane down very quickly. You need to write this email address down, dbj@mlmmailbag.com. You can reach out to Doug any time of the day or night, 24/7. He monitors that email account. Number one, licensed nationwide, Doug is. He is actually working in all 50 states of the union, helping people choose and thinking about all the alternatives for their Medicare supplement plan. Check us out at the website, medicareforthelazyman.com. We would appreciate it in your wanderings through the internet. Drop a review for us. We're still, head and shoulders ahead of the travel logs, and we want to stay there. Last but certainly not least, number 4, thank you. Thank you for joining us. You could have been anywhere doing anything, and you weren't. You were with us, which is where we love to have you. But doggone it, you guys never keep track of the time, so I always have to do that for you. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance guy, originally from Oklahoma. No more. He's up in the nosebleed section, the high rent district behind Cave Creek, Arizona. And I think today I measured it, and I think I'm going to have to put him down at about 7,200 feet. But
Ooh,
that is still kind of chilly up there, but we got to do what we got to do, right, Doug?
that's right. And I'm happy to take 7,200 feet. I'll take that all day long in this beautiful, warm, sunny Arizona weather. So sign me up for some more of that, Randy. And ladies and gentlemen, come on back for our next episode. I think you'll like it. I hope you will anyway. We'll be looking forward to seeing your smiling faces. Bye-bye.